Good afternoon, everybody. I hope you can hear me okay. And just before we start, in the heat of where I was staying last night, I had a dream that Elton John was playing the piano beside me, and I didn't know when to start, and I didn't know when he was coming in. So I'm sorry now if I burst into Yellow Brick Road or something. I'm just going to give an update around our plan to update the coding classification used for HIPE data collection in January 2024. And we're delighted to be able to bring you the updates on this and to fill you in on what's happening with it and what the plans are. So for those of you who aren't familiar with it, in HIPE we use a clinical classification based on the World Health Organization's ICD-10. We use the Australian modification of that, so it's ICD-10-AM, and that's for the diagnoses. HIPE is the procedure classification, so that's for the health interventions. And then the ACS are the Australian coding standards, so that's the guidance and the instructions for the coders. And we also complement that with an Irish coding standards as well. So collectively they're known as ICD-10-AM, HIPE, ACS. And this is kind of before it gets into DRGs. This is the kind of the raw data that goes into what makes up a DRG. So this data is collected and it's around identifying patterns and disease trends, and it's used for research and also more and more into the quality of healthcare and patient safety. So that's at that kind of raw HIPE data. And then it's used also to populate the A or DRGs. And that's a way of relating the number and types of patients to the resources required by the hospital. So that's just a little bit of background for those of you who aren't familiar with the terminology that we'll be using. So currently we're using 10th edition of ICD-10-AM, and we updated to that in January 2020. So we have to kind of keep currency in this system. We have to keep it up to date. Healthcare is changing all the time. So just trying to keep the system up to date is what we're all about. And it's just important that in the development of 12th edition by the Australians, so it's an organisation called the Independent Hospital and Aged Care Pricing Authority. They changed their name to that, IHACPA, from IPA previously. So when they're developing the classification, and this is a document available on their website, it's very useful if you're interested in learning more about how they update the classification for coding and also for the A or D or Gs, if that's your area of interest. But they gather clinical, technical, and they also do a wide consultation piece into the development of the classifications. And they also make sure that the classification aligns with ICD-11, which is kind of the next, in the future, at some stage, maybe in the 2030s, we'll be moving to ICD-11. It's the next stage of international classification of diseases. So they maintain a currency with that ICD-11. So we're going to be moving from 10th edition to 12th edition of ICD-10-AM, but we also have to bring the changes for 11th edition with us there too. So for the coders in Ireland, this is a it's a change to their working and how they do their work and the codes and the coding, but the process of coding stays the same. There's new codes and new guidelines to become familiar with. So as I said, 2020 we introduced 10th edition. I didn't mention COVID at all here because it's just this is just focusing on the classification journey. In 2022, we received approval in principle to update to 12th edition in Ireland. So we were able to kind of commence looking into it in a bit more detail. And it's interesting to note that Australia moved to 12th edition on the 1st of July 2022. So earlier this year, the licensing was in place for 12th edition, and then we were able to proceed with actually kind of getting our hands on the classification itself and having a look at it and see what was involved. So we started some initial communication out to HIPE staff, just that this is what we were looking at doing. So now we're at the stage where we're really starting to get into developing the systems updates, the education updates, preparing the whole system nationally for this updated classification. And keeping everyone informed on the changes and what's happening. So just to give you a little bit of a sneak preview, so I've just put 10th edition in the first column, so that's kind of what we're using now. And 11th edition is in the middle because we have to bring all those changes as well. And 12th edition is in the final column. So you can see the number of diagnosis codes is increasing. The number of procedure codes is increasing as well. So we're up now, when we go to 12th edition, we'll have over 6,500 procedure codes. But it's interesting that the changes around the coding standards, so these are the instructions, the guidance, what you code, what you don't code, when you code it, all of that information, that's kind of where the action is for us as coders in the HIPE world. So in 11th edition, they didn't add any new standards. They deactivated 21, but they modified 94 standards. Now, some of that could be a major modification or it could be very minor. And in 12th edition, then we've got 3 new standards, 41 retired standards, 9 amended standards. So altogether, there's 139 valid coding standards for HIPE staff in 12th edition. So that's really where the learning and the education and the time to update and get used to this new, the new classification. That's where it is for coders. So this is just a little bit of, I'm not going to go through all of this, but it's just to show you where some of the main changes were. So 10th edition, we had main diagnosis were procedural complication changes, conditions arising in pregnancy, and so on. In 11th edition, you can see some of the changes there. So it's interesting, one of the things that they've changed was around the FES, the functional endoscopic sinus surgery. So they've kind of sorted out some of the things that have been problematic for coders, and the same in 12th edition then. So the sepsis changes that they've made in the diagnoses, I don't know if this little pointer is working. Oh yeah, there we go. The sepsis changes. So Australia will now be in line with how we code sepsis here, in line with the international third definition of sepsis. So Australia have updated their system to reflect that international definition, which is great. And they also incorporate changes from the World Health Organization family of international classifications as well. Okay. So for those of you here from hospitals and managing HIPE departments or with senior managerial responsibility for HIPE teams, this is just to let you know what you need to start thinking about for this update. That your HIPE teams are going to need time. They're going to need time for training and implementing this update. So managing their workload, and that deadline for HIPE data will remain 4 weeks after discharge, and the demand for the data is growing all the time. So that will have to be managed through the update. And also managing that 2023 HIPE coverage so coders can focus on the update for 2024 data, that they're not kind of still trying to manage 2023 data months and months and months into 2024 when they should be concentrating on getting used to that new system. For a while in early 2024, coders will have to code in both systems. They will have to use the 10th edition and the 12th edition till they work through and close off 2023 data. So please support your HIPE departments in managing that and putting a plan in place for that. Also, you may want to look at any local reporting that you do. Will it be impacted by any new codes or how things are coded and the guidance around that? So it's just important to think about that if you're utilising the HIPE data locally. And I really think there's an opportunity for clinical engagement here. So if there's new areas or new codes or new developments coming in, to engage with their clinical colleagues and let them know about that and say maybe we could go through the data a little bit with you at the early stages, or if you were interested we can go through the codes. I just think there's an opportunity with the bring in the clinical colleagues into that piece. And just also, if you're looking at your staffing and your planning for the year now, just to think about that update is going to be happening when if you've new staff coming on, if you're things that you need to do in terms of data quality, maybe to look at how those things are scheduled and how you're going to work through those areas of work, because they will be impacted by this. And allow time locally for reading and discussing the update, because we will issue a lot of training material out to the coders and there'll be workshops and a lot of information. I'll come on to it in a moment. But coders need time to absorb all of that and to consider it and just work through it. So that's an important piece. And also there's a huge amount of resources that we'll provide, and there's also a lot of resources provided by IHA CPA on their website. So we're keeping coding staff informed of all of those, but they do need time to look at that and time to read through that and plan that with their teams. So for us at the HPO, we are obviously looking at the system and the training requirements and the education pieces. So dates and venues have been arranged for the update courses, and that will be the last quarter of 2023. And out at the HIPE stand in the foyer, we have those dates and the venues. So we hold them around the country, and Marie and the team would be delighted to talk to anyone about them. So it's like a save the date, and we've also issued it in coding notes that went out today as well. So additional training will be scheduled for 2024, and all our usual resources will be provided. We're also updating the IE book, which is the electronic version of the classification, all the coding rules, all of that, the day-to-day operational things that coders use. And we will provide a hard copy of the classification to each hospital in addition to the IE book. So all the data quality tools will be updated. So our data entry edits, the checker, the pick tool, all of those will be updated to 12th edition. And we'll also be monitoring coverage for 2023. We'll be monitoring that closely as we come maybe after the summer, just, you know, maybe some earlier intervention where we can see some issues around coverage, because we really don't want hospitals struggling with backlogs 2023 data in addition to an update. Also training ourselves, communicating out with stakeholders and data users, developing the guidance that we have to put in place, Irish coding standards and instruction manuals, updating all of our regular training. That all has to be kind of updated into the new version as well. And Marie has included here just some very useful information around the TU Dublin certificate course in 2024. So that's our certified training for clinical coders. So that will go ahead in 12th edition, and there'll be minimal impact on the first two modules of that. So it'll be that'll work well in 2024, and it'll be an updated TU Dublin course in 12th edition. So these are just some pictures from previous coding notes to do with updates. So like we've done this before. We do this every 4 to 5 years. Some of you have been through a few of them. Some of them you may have not been through any updates, but it works very well, and we have a good process around it. But just to discuss it with staff, make sure staff sign up to one of those training courses when the registration is opened. And we'll let everybody know when that's happening. Review and discuss the information provided. We'll provide all the training materials, and we'll be keeping in regular contact, as we always do, with the HIPE teams. So that's just a little bit about the 12th edition. I just wanted to mention a couple of other small points as well. Just to say thank you to everyone in all the hospitals for their 2022 coverage. 99.4% coded for 2022. So it's over 1.7 million discharges in HIPE. So that's a huge, vast amount of data, and it's a credit to yourselves and all your teams in the hospitals that we got that coverage. It was just fantastic. And I know for some hospitals it was a really challenging year to get that data in, so thank you. We had the ABF implementation plan meetings, and I had an opportunity to speak to managers and people that I might not usually come across in the HIPE world, but we did emphasise that point around managing coverage and quality and the support for HIPE departments, whether it's clinical, financial, management, whoever in the hospitals. The support for those HIPE teams is really important, because they can't sort everything out. They need support, and they need someone to go to, and they need particularly clinical input as well. And we recently completed the HIPE coder survey, and I just had some initial results, and now we'll do more on this in coding notes in September. But we had 45 hospitals, so it's preliminary, it's not final. Please, it's not final. There might be some changes to these. But the vast majority of those employed in HIPE coding are at grade 5 level. So 224 were reported at grade 5, 23 at grade 6, 11 at grade 3, so there could be other roles within the HIPE department, and 10 at grade 7. And there was a few in other grades as well. So it's just to show you that these are big teams working very hard to collect this data. And we asked some kind of yes, no questions. That's probably a bit too small to see. But out of the 45 respondents, whether there was a HIPE manager in post, so 31 said yes, there was. Is there a committee dealing with issues relating to HIPE or ABF? So 30 hospitals said no, 15 said yes. So I think this shows the need for managerial support for HIPE departments. Is there a standard discharge summary in use in your hospital? So the vast majority of hospitals, yes, there was. 39 said yes. Was the discharge summary used? So 42 said yes to that. Have you had assistance from in coding from coders from other hospitals in the last 12 months? So only a small number, five hospitals had assistance from other hospitals. And for question 14 was around group coders, and 8 hospitals said they had assistance from group coders. But I just wanted, this is kind of in the context of that update, just the management and the support and the structuring and the resources in those HIPE departments. There may be pressures on that as we go into an update if there's backlogs also. And some of the, Joe Hunter did this up, it's like a word cloud, because some of the questions were open answers. So these were some of the keywords that came up. So the first one was around clinical involvement and HIPE information in your hospital. So things came up like, they're approachable, or it was good, or there was, sepsis. There's different things coming up, but there's some, that they would like more, or some hospitals said it was minimal. And then around any other information about HIPE staffing, you can see there's things about grades, coders, new coders, leave, looking for managers, vacancies, backfilling, all of those pressures on HIPE departments around staffing. So as managers, call out to engage with your HIPE department and support them where you can. So I just want to say thank you to all the HIPE staff across the country and our colleagues in the HSE and further afield. And I want to say particular thank you to the team in the HPO and the HIPE team and all of those that worked in the background to all of this that we're presenting here today. And there's a huge demand for the services of this small dedicated team. And as Mark said, we're very willing and happy to help with anything we can out in the hospitals, but just, sometimes we're in huge demand. So just bear with us and we will do our best to deal with any queries or questions. And I've put the contact details there, and we're looking forward to 1st of January 2024 and the implementation of 12th edition. So that's it. Thank you very much. Thank you.